I think the pendulum is swinging back to heavy resurfacing in the areas such as around the mouth and around the eyes that really need it. And I use full field erbium resurfacing. I think over the past 20 years, people have sort of moved away from full field CO2 resurfacing because of some of the delayed hypopigmentation that they saw. And that pigment loss that we saw from CO2 resurfacing seemed to sort of collect as collateral damage the erbium resurfacing full field as well. And I don't think that's the case. Erbium resurfacing allows you to have recognition of endpoints in terms of pinpoint bleeding. There's also less heat, and it's more efficiently absorbing water. So really, in my hands, resurfacing with erbium full field is the right tool for the job for people who have significant etch lines and wrinkles around the mouth and around the eyes. And then I may do fractional ablative resurfacing with less photo damage on the rest of the face, or I may do actually a blend of both full field erbium resurfacing and then fractional ablative, either erbium or CO2, on the rest of the face. So with erbium resurfacing, patients are going to have more bleeding, but that's actually the endpoint that you're looking for, that pinpoint bleeding. And in many cases, we see these patients over the course of the next week and a half or 2 weeks in the office, help clean them up, show them photos of what to expect. And then some of these patients are really fair complected, so they may have delayed post-inflammatory erythema and redness for even weeks or sometimes several months. And the best time to really see patients back for their final follow-up photos is at really 3 or 4 months, because that wound healing response and that contraction and usually that post-inflammatory erythema is resolved, and that's a great time to really see what their improvement is and then hopefully pick up the plan sort of for maintenance procedures that they can do later on.